And we are live.
Hi.
We are.
Welcome to Suzie. It's Suzie and Matt.
Woot.
Yay! Live from Suzie Health Solutions, your full-service enrollment center
In Wenatchee. So today we're gonna do the little bit of house cleaning.
Okay.
Because it's one of the top questions we have.
Yeah.
It's like, who do you work for and how do you get paid?
Yeah, usually it's how do you get paid.
Yeah.
Sometimes we get who do you work for, but mostly it's how do you get paid.
Or do I owe you anything for this?
Yeah. What do I owe you? Can I pay you? How much are you going to charge me for this? All very different variations of the same thing.
Mm-hmm.
And the simple fact is, we're not going to charge you a fee for our services.
Yep, we never have. We've never done the thing that we're able to do, and that is charge a fee. You'll never write a check in our name.
Right. Now, when we first started this early on, and we were discovering that some of the insurance companies were being a little difficult, we asked the Office of the Insurance Commissioner, well, hey, what can we do? And they said, well, you can always charge a broker fee.
Mm-hmm.
And some of our that's what I'm looking for. Peers do.
Mm-hmm.
We've seen as high as $500 a session just to enroll somebody in an health insurance plan.
To be fair, a lot of those are with the group policies. And it's
we've seen some for individuals.
Some for individuals.
Yeah. Usually it's not $500, but it's still a fee. We don't do that.
Yeah. Prior to like the ACA, we as insurance agents,
Mm-hmm.
we could get certified, and when we enrolled someone in Medicaid, for example,
Mm-hmm.
it was the Washington Health System at that point. It was you'd get a check for $100.
Yeah.
It was compensation for your time.
Right.
So that went away with Apple Health.
Mm-hmm.
And there's some weird things going on there.
Well, I think the initial theory was, hey, we're going to create this self-serve system. We don't need you anymore, so we're not going to pay you.
I don't see that's one of the arguments that's being made out there. It's like, oh, we're going to do this great self-service, but on the same hand, we're going to be paying groups to manage.
Yes.
And that's one of the things that is really.
Oh, that just grates your cheese.
It grates my cheese because it's not transparent.
No, it's not.
Because DSHS does pay the Washington Healthplanfinder a fee to manage Washington Apple Health.
Yes.
They, in turn, they go out and they say, oh, hey, these, I'm trying to think what the group names are.
What, like Navigators?
No, it's the Navigator groups.
Oh, like
Better Health.
Yeah. Is Room 1 a Navigator?
No,
that's a separate.
That's okay. Separate. Okay, because you get a next level down from the Healthplanfinder. They disperse the funds to groups that run Navigators.
Okay.
I can't think of the name off the top of my head.
But yeah, Better
Better Health's over in Spokane.
Yeah.
They used to run our area. Now Confluence is, and they get a chunk for every policy that they manage.
Right.
At least that's how the last contracts I had my little hands on were.
Mm-hmm.
And then they disperse those funds out to the Navigators in an hourly format.
And they get an hourly wage.
They get an hourly wage,
which is perfectly fine. More people employed, we're all happy.
Yeah, they're a W-2 employee in most cases. There are very few true volunteers out there that are volunteering their time.
They do exist.
Mm-hmm.
They're not that common. But we're also not going to begrudge someone their paycheck.
Oh, no. And we actually tell people, it's like, yeah, if you want the most of customer service, you sign up for both a broker and a Navigator.
That's exactly right.
Because there's two different systems and there's two different advantages.
Right. Navigators have a set of skills that sometimes they have more access through their supervisory system to certain tweaks, the whole super user concept.
No, because we got access to super users as well.
Yeah. Well, we didn't for a while. Not like they did.
Yeah, there was a weird bias, favoritism in that, and they still really have this, can't figure out on what to do with brokers and enrollment centers.
Yeah, well, enrollment centers are relatively new. We've been around for 4 years, 5 years.
This is actually the 6th year.
Has it been?
Yeah, it's our 5th year. And an enrollment center is kind of unique in Washington State. That came from an audit. It was like year 1, year 2. They said, hey, you need to involve brokers more because they're a cheaper alternative than running these Navigator programs.
Because
we're
not getting paid by
and there's a higher customer satisfaction number associated with brokers.
True. We have a tendency we're able to spend a more, I don't want to say a higher amount of time, but our time is definitely, it's definitely more focused. And because we can actually, as licensed brokers, can suggest a plan that would fit somebody's needs, whereas a navigator who's not licensed in insurance can show you plans and show you prices. They can't say this is the plan that suits your needs best, but we can do a needs-based assessment. That gives us more value, a different value.
I think that the biggest one that I can see is the add-ons.
Okay, go on.
A navigator can give you this is how this plan works.
Yeah.
Good luck.
Yeah.
We can say, oh, hey, this network is tight. You're planning on travel to Oregon. Here, you might want to pick up a travel plan.
Yes, that's also that.
Or hey, you're 64. You're aging into 65.
We'll talk to you about Medicare.
We can talk to you about Medicare.
Well, another thing we can also do is talk about ancillary products. Like Matt said, the travel plans. But another thing that we can do is show you off-exchange dental plans and vision plans.
That was the first thing we did. Was we brought in a one-off dental plan and a one-off vision plan when the exchange weren't offering those.
Right. When the first couple of years they weren't offering options at all. When they started offering dental, the first couple of years it was just a usable dental plan. The last couple of years has been a little less usable if you have anything more complicated than a filling that needs to be done.
Well, that brings in the importance of branding.
Okay.
Because we're seeing it more and more in particularly in the health industry.
Yeah.
Delta is notorious for this. We use Delta. They've got a good product.
Huge network.
Well, they were the first dental insurance.
Yes, they were.
However, the big key factor is they'll put together multiple programs.
They will.
So depending on where you're accessing Delta Dental from, the plan can be completely different.
Yeah, we've run into that. Your initial goes straight to Delta Dental. There's 6 different plans. If you go to Delta Dental, say, for example, through AARP, you're going to find plans that may be denture focused.
Yes.
And that's a good example. So it's not necessarily a bad thing to shop around if there's something specific you're looking for. The ones that we've got for just the everyday standard straight to the horse's mouth plan are very good for for people with average needs.
Correct. And there are like group plans for Delta that includes orthodontic work.
That's right. That is absolutely true. And I think I've only ever seen them under group. I've never seen them do an individual with orthodonture.
Correct. They've never done one. However, we do know that the exchange Delta is a group policy.
Yes, that's how they're defined.
So there is nothing whatsoever from the council that runs the exchange from putting together an orthodontic option on that exchange.
Okay, one of the problems I see about that option is the fact that it takes more than 12 months to take care of dentures, which means you need to be in that contract for an extended period of time to take advantage of it.
No. I said orthodontics.
Yeah.
Yes, it does take a long, extended period of time.
Yeah.
However, you're not going to be working at a job necessarily extended period of time. We've seen Delta extend out contracts for they hit up people 90 days out because they wanted retention.
And then you can purchase the plan individually. It's like a Cobra concept.
Well, you didn't purchase it separately. You just maintained it.
Well, yeah.
We've seen that happen.
Okay.
So to say that oh, hey, you have to. It's like, no, the entry point is through the exchange. Yeah. So there's nothing stopping them from putting one together.
I don't know the mechanics of it. I can't speak with enough confidence to say that would be a brilliant idea. I think there's a lot of potential pitfalls there. But I also know that they're not putting together. I mean, right now they're not putting together an awesome plan for dental, for just basic dental.
You have to get up to that premier level, but that's
No. For an exchange plan.
Oh yeah.
Yeah, they're not offering a good plan.
No, they've stripped it down and it's based on price because no one explains how it works.
Right, exactly. It's like, oh, here I got dental and
it's one of the biggest things that we do is we explain how the dental works, and it's like, okay, you've got these options. What would you prefer?
Yeah. If you've got, I don't want to talk down the plan because it does have its value.
It's great because there's no waiting period.
There's no waiting period. It's a great entry plan. It's great if you've got bulletproof teeth like I do. Mm-hmm. If you need a crown or a root canal, it's not your plan.
Yeah, they pulled that out. It used to cover those.
Great for kids.
Awesome for kids.
Awesome for kids. Not so good.
Dynamite
for kids. Not so great for adults.
So now the other thing is okay. So let's get back to where we get
loop back around
to how we get paid.
We get our dollars?
We have to affiliate with a insurance company to get paid.
Correct. And it takes some lists of contracts. It's some paperwork. It's sometimes working with what's called an MGA.
Yeah, we have to. I fondly refer to it as jumping through flaming hoops of fire.
Yes.
Alexa, turn off. And it's a fight because we're a small business.
Yeah, and they'd rather work with the larger companies just because it's paperwork that they want to maximize, among other things.
That's a kind of a banker's concept.
It's a banker's situation, babe. Yeah, it is, and you know it.
It's the fight between the insurance mentality versus the banker mentality. We run on very insurance minded.
Yes.
Lots of small customers, and it flows in. However, not all insurance companies contract.
Correct.
So we don't get paid for every policy. We don't get paid for Apple Health.
Nope.
Because as the people in the exchange have told us multiple times that they are forbidden to be able to fund us for managing Apple Health. Therefore, they're able to pocket that money that DSHS gets them.
Do you ever find out why they're forbidden?
They've said that they legally can't. So the easiest way would be for a legislator to actually change the law.
Okay.
But we're yet to see any legislators step up and do any sort of rights for
they
agents.
Haven't even looked at it.
Oh, because we're small businesses.
Yeah.
There's about 1,400 of us running in a Healthplanfinder.
I wonder, is that a federal thing or a state thing?
Probably a little bit of both, because we're an enrollment center, we jump through another flaming hoop of fire contract, and we do a proposal. We have to put in a bid for how we spend money, but we're also reimbursed for certain things.
Right. It's to a certain degree a grant that has to be justified. And what we do, you can use that particular grant if you're an enrollment center for...
I'm not going to call it grant.
Okay.
We can't call it a grant. It's a reimbursement.
Okay.
And the reason why, if it was a grant...
We could do whatever we needed with it.
We could do with whatever we needed. It's just an initial, hey, boom, here's the money, you're done. Do what you say, and there might be a follow-up process.
Okay,
if you're lucky.
But this is a reimbursement situation where we spend the dollars, they justify it to them. They give us the dollars back.
Yeah, we have to have receipts. We have to do reports every month. and we report back.
Right, and these dollars that we have access to, we can use them for certain things, and that's part of the budget we have to submit. We can hire people if we need to. We can do a little bit of infrastructure. Mostly, our office, we use it for mostly marketing.
Yeah, because we don't want to ever need a temporary person, because that is, and here's the goofy thing. It's like, and it really shows a culture divide. As insurance agents, one of the things is we protect our customers' information.
Absolutely. It is as number one priority is making sure that your confidential information stays confidential.
It's just kind of built into our nature, and you can tell a good insurance agent on how well they, on how that they're kind of obsessed with protecting the data. We don't hire temps for that reason.
No, we won't. It's just no.
It's like if someone says, "Hey, you should have a receptionist, and here's a few grand to help fund them." It's like, well, that's nice. Well, we don't want them.
Yeah.
And the reason why we'd rather struggle instead of bringing in someone on a temporary basis is we don't want someone to have access to that information because it's confidential information, and then walk out and do whatever.
Yeah, it's not okay with us.
It's not okay with us. Some of the Navigator programs early on ran on that.
They did. They'd hire seasonal temps, and they ran into some pitfalls. And that's one of the reasons why some of the rules got changed.
Spokane. That was the big one.
That was a big one.
That was the big one, and we've always refused to do that. If someone says, "Hey, you know what? It sounds like you've got a really good thing," we will talk about running splits, because that's how we run our business is splits. Yeah. We actually split half if we're get a commission from an insurance company. Then we split that with the house.
And their split goes to mostly overhead. Yeah,
mostly rent. Rent is expensive.
Yeah, always will be.
It always will be. So, for example, let's throw Delta. I want to say Delta's running, what, 10%?
Yeah, something in there.
It's either 8.5 or 10%.
Yeah,
it's not a huge amount.
No.
It's
and considering a policy is about $50.
Yeah, it's about $50. So you're dealing with, if on a good day, $5. We get half of that, $2.50.
Right. Half to the house, half to us.
So, $2.50 a month for a policy. It kind of shows why we do what we do, is we keep writing dental policies.
It's a game of numbers.
It is a large game of numbers, because, as you pointed out last month, it's like, oh my gosh, we're making about $200 off of dental.
I know, which floored me. It really did, because we always thought dental was just one of those little happy little add-ons. We never really build up to anything of any consequence, but it has.
Yeah, it's actually grocery level money for us. And that's one of the things is when you support a small business in the middle of the state, yeah, it really is about groceries for us.
Yeah, I mean that is literally, that's a couple of weeks worth of groceries for us.
We tell people, it's no big deal.
No, it's not.
If someone says, well, how much how much are you getting paid for this? We'll tell them.
Oh yeah, absolutely.
Just point blank that this is how much we get paid for it. And most of the time they are shocked, because it's that little.
Yeah, it really is. So what it boils down to is we work for our clients. We get paid by the insurance companies that we're affiliated with. We don't get paid for every policy that we write, because not every insurance company commissions insurance brokers.
We're not middlemen.
No, we're not.
To say we're middlemen is kind of insulting. We're not paid by the insurance company.
No.
We're not employed by the insurance companies.
Yes, we're not employed. We're contracted with, but we're not employed by.
Correct.
If we're employed by, we would be sitting somewhere in a boiler room making cold calls.
Yeah, and there are groups out there that do that.
Oh, totally. I ain't gonna be that person.
We ain't gonna be that person. Actually, it's the big one that we've seen grow the last couple of years was Molina.
Yeah.
If you go online, you'll be able to see, well, what's this person? Why are these guys in California?
Mm-hmm.
And that's because they're running They're running a call center.
Mm-hmm.
They're contracted to do business. They've got their license. They're contracted in probably multiple states,
Mm-hmm.
and they work with just that company.
Right. It's considered a captured agent.
Yeah, they truly are a captured agent.
Right. And they work for probably a salary plus commission.
Hard to say.
Yeah, I don't know. That's an interesting question. That's another conversation about,
because I know that there was
an insurance agent.
The first couple of years there was a group out of Spokane with Primera
mm-hmm.
that were killing it.
Yeah.
And so there are captured agents out there, and that's why we say if you go to the Enrollment Center,
mm-hmm.
you'll have access to see all the plans.
And you're going to be dealing with somebody locally.
Locally, yeah. There are 11 throughout the state.
Yep.
But we are under contract.
Mm-hmm.
And that's what most people don't know. To get that Enrollment Center contract, we're under contract to be able to talk about all the plans.
Exactly. And we won't cringe from it. And
yeah.
We'll tell you the truth about them all, whether they like it or not.
And that probably got a few of them to say, oh, yeah, we should probably start paying some of these guys, even if it's subpar.
Yeah.
You're
right. I'm just amused by that phrasing.
Well, it is, because one of the nice things about being as in the industry as long as we are, and the first couple years we had plans that were percentage based.
Mm-hmm.
So if someone our favorite customers were in their 50s or 60s with a large premium.
Yeah, because we get a percentage of their premium, which could be $30 or $40.
Yeah, and now we're down to this next year we will have a carrier that's paying $10 per person per month.
Right. Yes, that's $120 a year.
That's $120 a year. It's one of those ones. It's we're looking at half of that, so $60.
Mm-hmm. But we're not gonna. But if it's the right plan for you, we're still gonna put it in.
Oh, absolutely. We put people in some of those plans and got paid nothing for it.
Yeah, absolutely.
And it's
because we want you in the plan that suits you best. Now, another thing
mm-hmm.
we're running into is it's not just individual, but Medicare's doing that. There's some of the Medicare drug plans are not affiliating with brokers anymore.
Yes. Some of them are not. But we had a really good example of a Medicare Advantage plan in the area
mm-hmm.
that were using captured agents
mm-hmm.
and would only offer out a finder's fee.
Yes.
To outside agents, and we refuse to play that game
because we want to be able to service our clients.
Well, yeah, and it's like we don't know how well that captured agent is or that employee is.
Yeah,
because that's what they are. They're an employee of an insurance company.
Right.
We're one of those ones that's like, okay, spin the wheel. Which plan is best?
Yeah. It needs based assessments.
Mm-hmm.
Mm-hmm. But yeah, and the fact is, it doesn't matter if we get paid for the plan by mm-hmm. commission or not. We're still going to pick the one that suits you best.
And we do this. We'll do this as long as we can. Mm-hmm. I have to caveat because every year our partner up in Quincy comes to us and says, "Oh, are we going to be doing it again this next year?" Yeah, because he can't believe that we're still profitable.
And growing.
Mm-hmm. He gets shocked every year. We've grown 30% or more.
Mm-hmm. It's been a good year.
So it's been like 4 years in a row we've done that.
Or because of you, because of our clients, because we've grown. We've grown because our clients trust us and they tell their people about us. And so their people become our people, and we're just building this lovely little
it's a
circle of trust.
It's a service model.
Yeah.
And we've done that. We actually had a great conversation with a client yesterday on long-term care.
Yes.
And she's like, "Well, where do I go next?" And we gave her 3 companies, local companies that we said, okay, this one should be able to answer your answer.
Right, because they represented insurance companies that we don't. And she wanted to explore all of her options. So we referred her to this person, that person, the other person, because we wanted to make sure that she had all of the information she needed to make an informed and educated decision that suits her needs.
And that's the big thing. And she's referred people to us for years after discovering us.
Oh yeah, she's one of our good clients, and we're always glad to have her just stop by and say hi.
Well, yeah, she hasn't been a client for years.
No, but she's referred people. Exactly, she's still a good person.
And that's what people don't understand. It's like because we do so much service in the life and health industry locally, we become a community asset.
We are.
We're not paid through with your taxes. That would be like a Sheba model.
Yes.
Because in order for Sheba to run its office, they actually get a budget from the Office of the Insurance Commissioner, which is paid by our taxes.
Right. They are volunteers. They also get reimbursements in other ways.
For mileage.
Yeah.
Whereas we jump in our car and scoot around and you see our car scooting around. No, we don't get reimbursed for that.
Not at all. So that's if you want to know how we get paid for the insurance companies. There is one instance in this office where you might actually pay, and that's when I do a notarization for you if you're not one of my clients.
That is true. You are a notary.
I am a notary public, and I will charge you $10 for a notarization.
Yeah.
Yeah. Because that's kind of a must do.
Well, it's
just one of those things.
Yeah, because you're notarizing other documents. For our internal clients, you don't charge anything.
Correct.
For example, there are some documents that go upwards in the exchange where you need a notary.
Right, and that's why I got my notary license, just in case we need to have something notarized for one of our current clients. If it's someone we're working with for their health insurance or their life insurance, I'll notarize it without it. Just splat. There you go. If it's somebody who is changing a car title and I really just don't know them, but they need a notary, I'll charge $10. That's the only time you might see money exchange in our office.
Yeah, so that's
and that's just me.
That goes to Team McColm.
It does.
We actually got some accounts set up for that. We do things. This is a completely different model. It's the easiest way to phrase it. We run a profit organization in a nonprofit manner.
Yeah, that's a good way to put it.
Because in the end of the day, we do a lot of charity work. We do more charity work than some charities.
Yeah.
We get paid somewhere between 1 and 4 policies we write.
Right in that zone. Probably 25, maybe 30% of the policies that we write, we get commissions for.
Yeah, so
because we have a lot of people using Apple Health.
Yeah,
and we don't ever flinch from them. Ever.
Yeah. The reason why we had a moment was originally when this was set up, we sent folks to one of those Navigator organizations for like the first 2 weeks, and they never returned calls.
Yeah.
I would give them the lead person's phone number, and they wouldn't return calls.
Yeah, they were not getting the job done. So we started doing it.
So we said, okay, fine, we'll do it ourselves. And
it's not like
it's taking care of people.
It is taking care of people, and it's something we knew how to do, so there was no reason not to do it.
Well, the reason not to do it is you don't get paid. So there are some.
Okay, there are reasons out there to not do it, but we don't subscribe to them.
We don't subscribe to that. We've seen a lot of. There are brokers out there that won't.
No, they won't touch. They won't touch it with a 10-foot pole. We had one yesterday. Fellow was hooked up with a broker when he was enrolled in a qualified health plan. He moved, became eligible for Apple Health. His broker dumped him and said, you need to go talk to somebody where you're at.
Well, yeah, and that's the thing. They didn't dump them. They were still attached to him.
But they wouldn't serve him.
They wouldn't service. They expected him to wander off and get service elsewhere, yet they wouldn't disattach, because that's the thing. You can dump brokers like that.
And Navigators.
My
guess is the other broker was expecting them to hook up with a Navigator, and then if he came back into a QHP, he'd continue to get the commissions.
Well, yeah, because there are a lot of brokers that are attached to the organization, yet they won't write policies.
Correct.
They do that. It's just as a feed.
It's a little source of income flow.
Because it costs us $50 a year. We have
a little bit of training.
And a little bit of training to maintain what we got.
Right.
So there were some folks that signed up. They may have written a bunch of policies years ago. And they're not actively seeking it, or they might do it as an incidental.
It's passive for them. It's passive income.
And we've seen people who do that, and they're not interested in growing their books. They're interested in doing the minimal effort to maintain. And you really got to decide is how you want to spend your community dollars. Because that's what it boils down to, is because if you're attached to a broker that's not out there actively serving the community, it's awesome you're supporting a small business. Woohoo. So like we tell people, it's like, yeah, select someone that's in state. Select someone that's out there that's being a go-getter.
Yes.
If they're not going out there helping people, they're not spending money in the community. That's an easy one to look at. It's like, okay, how are they out there in the community? Are they walking around? Are they talking? Or are they going to Vegas every other weekend?
And that's been known to happen.
Okay. So we're going to end that on that. So yeah, we're not insurance company stooges.
No.
We don't get Soros dollars.
No.
We happen to get paid by those guys, but we're not employed because we're one of the first ones that will throw them under the bus.
Yep.
If they need to be thrown under the bus.
Oh yeah, I've done that more than once. We're a mom and pop organization that's here to serve our community.
Yeah, we're a small business outreach.
We are. And we're happy to be it.
Yep. So that is kind of the nutshell on how some of the healthcare customer service folks get paid.
And if you got questions, don't hesitate to reach out. We're here.
We're here, and we can definitely answer the questions. So yeah, if you're interested in doing that, we actually had a few reach out to us last couple months. It's like, oh, I'm doing this. It's like, awesome. Go talk to all the different groups and see what you like best.
Exactly.
All right.
Have a good day. Thanks for joining us, Zilla, and we will be back probably next week.
Yep. Bye.
Okay, bye.